Hello friends, welcome to my channel, The Homeopathic Gust. Today we are going to study about borax. It is a medicine from the mineral kingdom, the chemical name being biborate of soda. In earlier times, the powder of borax was mixed with mud and used to treat aphthous conditions. In homeopathy, we have powderized this powder and the medicine thus formed is used extensively to treat apathy. It is widely used as a children's remedy at the times of dentition. The keynote symptoms of borax: fear of downward motion and heights, oversensitiveness of surroundings, aphthous condition of mucous membrane, ailments from smoking, mental symptoms ameliorate at 11 p.m., discharges hot, thick, acrid, startling from sudden noise, aggravated from downward motion, smoking, fruits, before stool, before urination, ameliorated after stool, after urination, 11 p.m. The mind symptoms of borax. The patient is fidgety and anxious. He will startle at sudden noise, unexpected news, emotional excitement. This shows his sensitiveness. Even his anxiety gets worse from downward motion. The patient shows hysterical behavior. He does not complete one task and jumps to another. This keeps repeating and it's difficult for him to stick on to one occupation. Apprehension, fears, and nervous excitement is very marked in borax. He is very sensitive to his surrounding with intensified hearing and anxiousness. The child of borax is very lovable and affectionate. He will hug and kiss people around him. He is attached to his mother and clings to her. He even sleeps clinging to her. Fears of borax: fear of downward motion, fear of falling down, fear of sudden noise, not loud shrill noise, fear of being infected by some contagious disease. The fear of downward motion is so marked that he will cry every time the mother puts the child in the crib, or someone is rocking him, or someone playfully throws him in the air. The patient gets anxious when he is in lift, which is going down. He is also very anxious on riding rapidly down the hill. The downward motion also produces vertigo in the patient, along with anxiousness. Physical generals: desire, sour things, intolerance to fruits, it causes diarrhea, sleep, wake up frightened, grasping the cradle without any apparent reason, dreams of falling down in the hole, mouth, dryness of the membrane, eye, inversion of eyelids causing infection and pain in the eye. Aphthous conditions of borax. The mucous membrane of the patient is affected very aggressively. The apathy formation occurs right from the mouth, producing ulcers in whole buccal cavity, on tongue, on inner side of the cheeks. In esophagus and stomach, the patient throws out water immediately after drinking. In anus, the stool becomes painful. In urethra, urination becomes painful. The child cries every time they have to pass urine because they know that they will be in intense pain during urination. The child is unable to eat and hence may look like a patient of marasmus. The borax should be compared with the natrum as it has component of sodium in its chemical formula. Its likeness with natrum is very marked. For example, aggravation from noise, oversensitiveness to noise, and oversensitiveness of the nerve running through the remedy. The female of borax. Acrid leucorrhea gushing down, leucorrhea like white of egg and appearing for 2 weeks. Dysmenorrhea before the menses. The pains are labor-like. It is membranous dysmenorrhea. During the flow, it seems as if uterus would come out of the vagina, that is, bearing down sensation. Sometimes the female can't nurse the child as the milk production in the mammae decreases and it becomes thick and unfit for nursing. Here, borax can definitely help. The mother might have aphthous conditions in the mammae, and whenever the child nurses from one breast, there is pain in the other breast. The relationship of the remedy. Inimical, acetic acid and boric acid. Antidotes, Chamomilla coffea, and compare Calcarea carb, sulfuric acid, Bryonia. Thank you for watching. I hope you liked the video. Please like, share and subscribe.